Right. Can you see that? Give us a thumbs up, someone, if you can see the screen. That'll do. Great. Okay, we can't see you so well, so things change when it's in this view. All right, so welcome. Today's public health team are Anya. Give us a wave, Anya. Julia. Give us a wave, Julia. I'm Sarah. Amber's around. She might give us a wave. And Alan's here, who's going to give us a wave as well. He's the best waver so far today. He does really good waving.
Thank you.
Thank you. Okie dokie. So without any further ado, we've got loads to get through today. We're going to be talking about quick overview, quick update on the latest data and numbers. We're going to talk about community testing. We're going to try and have a quiz and see what you know, and test the champs. You are the champions. So let's see what you know. And then we've got a little bit of an ask for you. One of the things you've been letting us know is that you want more to do. So we've got a couple of things to ask you to do, please, champions. And then we'll get to questions. We're really tight today as well, so do forgive me if I run along. Now, for those of you who've not been here before, we would invite everybody to stay on mute unless you're speaking. And if you want to speak, please raise your hands. There's a couple of little icons we can use to raise your hand. Or you could, of course, just sort of manically do this and hopefully someone will see you. We will try and get to you, I promise. If your signal's poor, just disable the video. We find that helps make the sound a bit better, and you can also post questions in the chat. Apart from that, be nice, no fighting. You know, we're all here for a good time, so we hope this is positive.
And we were going to video.
Absolutely. Thank you, Julia. Sorry, I had forgotten. The other thing to say is we will be recording this session and it will be posted online. So if you're uncomfortable with being recorded, please either you're welcome to leave or put your screen on blank so there's no imagery. But this session will be recorded and published. Thanks, Julia. Okay, so if you have a question, you can use the chat function. You might be able to see the little chat button below you. And if you want to speak, you can raise your hand that way. But there's lots of icons as well. So just sort of make a bit of noise and we'll come to you. Quick overview. Some of you might be new to Champs and thinking, what am I doing here? What's the point? The idea is that we, Torbay Council and our NHS partners and everybody here in the public health department in the council would like to give you the right information, and we'd like you to pass that on to your neighbours, your friends, your colleagues, just people in your world. And the hope and the idea is that what we do is we create a real virtuous, reliable amount of information going out. We know that there's a lot out there and a lot of concerns, so the idea is that we just simply help influence you with the right information. It's credible. We can assure you that the information we give you is the latest and most up-to-date scientific information, and we're also quite honest. If we don't know, we'll go and find out and we will let you know. We're not going to busk it. I think there's enough people busking it out there, and that's not us. So any questions? Are you in the right room? Are you in the right forum? Yeah? I can't see if there's any questions, so I'm going to keep trucking if that's okay.
Carry on.
First thing I wanted to do is say, you champions, you legends. A little while ago, in November and December, the clinical commissioning group in Devon asked the champions and lots of other groups in Devon and Torbay to fill in a questionnaire to give some insights about what Devon residents really think about vaccines. That report has been published now, and without your help and input, it would not be as accurate, and we would not have managed to get the views of people from Torbay in. It's quite an interesting report in some ways, and one of the key things that we found out is that champions and role models are really, really important. The council can say these things till it's blue in the face, the NHS can say things till it's blue in the face, but actually what really, really, really matters to people is what their friends and family think. So please, your role is massive. You are the trusted source. So thank you for participating in that. Just to let you know that on the basis of that report that was done, campaigns and plans are underway to do more vaccine campaigning and rollouts locally. So we might come back and ask you a bit more about communicating vaccines with your people. But yeah, if you've got any questions, let us know. And the link to the report is there. It's in the public domain. You're very welcome to see it. But thank you. Thank you. Cheers. I'm going to hand over now to Julia and to Alan, who are going to talk us through. Oh, no, I'm not. No, I'm not. I've jumped the gun. I was going to do the data.
Oh, yeah. Right.
Sorry. Right.
It is exciting. You need the data. It's always the key thing.
This is why lots of people are here, I think, actually, is what's the latest data? Okie dokie. So the pink line on the far left is the end of the old lockdown on the 2nd of December. And the red line is the start of the lockdown that we're in now. So as you can see, the rates have fallen since mid-January. We've had a small rise and a plateau around late January to early February, and we're plateauing again. So this is the latest 7-day period ending on the 20th of February. We'll have more data towards the end of this week, and we'll put that in the bulletin for you, which comes out next week. This is where it starts getting quite interesting. So this is, again, our local COVID cases. And what we're seeing is that those aged 60 and over have a lower case rate than those under 60. So generally the highest rates that we're seeing of COVID-19 in Torbay amongst the working age population. So those 20 to 60 year olds in particular. Not that people outside of 20 and 60 don't work, we know that. But those are the groups that we're seeing the most COVID cases with in Torbay. And that's across all 3 towns as well. That's not just any one of our towns, that's all towns. We have seen a rise amongst cases in the 0 to 19 population, although these rates are still lower than that 20 to 60 group. So the take-home message is, who's getting COVID in Torbay? 20 to 60 year olds. Everyone else can still get it, but those are the people who are getting it the most. To illustrate that a bit more, I've got a different type of graph for you, and this gives you a bit of a sense and proportion. So the red ones mean it's above average. So people who are 0 to 9 years old are below average in terms of the numbers of sort of COVID cases. 10 to 19 is about the same as the England average, but 20 to 29, 30 to 39, 40 to 49 and 50 to 59 are all above average. You can see that really dips for the 60 to 79s where we're below average, and sadly our 80 pluses are disproportionately are the same across other places in England. So yeah, just to really kind of like emphasize that message to you, it's the 40 to 60 year olds the 20 to 60 year olds who are bearing the burden of COVID transmission. In terms of deaths, we're really sorry to report that there have been 38 COVID-related deaths for Torbay residents in the last 4 weeks. Tragically, most of these deaths are related to care home residents. And I'll just let the graph speak for itself in some ways. There have been more COVID-related deaths in the period since October than in the first wave from March until June. So we've been hit in the last wave with more deaths in Torbay than we were in the first and second waves. However, to compare us to other places in the southwest and England, the 3 lowest local authorities, Julie, are going to have to help me on this, but I think the 3 lowest local authorities in the whole of England are Devon,
Plymouth and Cornwall. Yeah.
So we're in Go on,
so
please.
it's just making us stand out more. It's making us look a bit higher because our neighbours are particularly low just at this moment. Like a couple of months ago, we were the lowest in England and now they are. So we're just not reducing at the same rates. We're just stuttering a bit more in our reduction in numbers. Yeah.
Okay. So that's the numbers. Any questions from anyone? Is there anything in the chat, first of all, Anya and Amber? Any questions there, please? Okay. Does anyone want to unmute and ask any questions?
There's a question asking from Eileen, asking whether the deaths are including patients brought from outside of Torbay.
No, it's Torbay ones. Yeah.
No, this was for Torbay residents, not Devon residents or others in the hospital.
When we look at numbers, when we look at numbers in hospital, that might include people who aren't Torbay residents. So when we're saying numbers in ICU or numbers on wards, that could include others, even patients from other parts of the UK. But yeah, when we're looking at deaths, we're looking at hours.
Yeah.
It's Nigel. Can anybody hear me?
Hello,
Yes, we can
Nigel.
hear you,
Oh,
Nigel.
my God, it works this week. Two questions. It is confusing for everybody where all these figures come from, because I think if anyone looked at the local news last night, it implies Torbay's increased in the last 7 days. And the other question I would have, the deaths in care homes, has there been any logical reason why specific this time it has been deaths in care homes?
I think in terms of the deaths in care homes, throughout all the deaths that we've had have been mainly in the very much older population, and so this isn't a new thing in the last peak that they've been care home deaths. We think we might be starting to see a slowdown. Of course, people were vaccinated in care homes, but that was now about 3+ weeks ago, in some places 2+ weeks ago. So it takes a little while, and it's only the first dose of the vaccine. So we think and we hope we are starting to see an impact, but it's still quite early days, so we've got to watch what happens there. But it wasn't, you know, it's the most vulnerable population. So once you do get cases, those are the population that are most likely to get seriously ill. Is that what you meant there?
Yep, that's fine. And regarding the results, that Torbay is higher this week?
We're seeing a plateau. We're not thinking that we're seeing an increase. We've seen it feels like a stuttering reduction is how I've seen it. So it's sort of like down a bit, plateau a bit, down a bit, plateau a bit, and the last week's been plateauing a bit. So we haven't felt our trend has massively changed. It's just that we seem a bit slow and a bit creaky in coming down. But we can't find a particular thing. So other than, as Sarah stressed, it's all in the working age. Well, most of our numbers are in the working age adult population. There's no particular pattern in our wards or in our towns or in a particular profession or setting. So, you know, we will keep watching it really, really carefully day by day, but no one particular thing, more just people being out at work or socialising, and that's where they're picking it up. And of course, that population haven't yet been vaccinated either. So that would have a bit of a lag.
Okay, that's great. Thank you, Julia.
I've got 3 more questions from the chat. The first is whether, whether the numbers, it's basically whether we're expecting a spike in children when they return to school and whether children are more at risk with the new variant. And then I've got 2 other questions as well. So
I don't have evidence that children are more at risk of the new variant. You mean like the variant that's most common now, which was the Kent, southeast of England one? That's the one at which everywhere, it spreads that bit more quickly, isn't it? It's that one, which we think is the commonest in all areas now, including in the southwest. There was a bit of talk about that earlier on, but I haven't seen anything in terms of evidence saying it's worse, you know, spreading in children than other populations. We do expect we will see more cases when children come back, just because there will be more children in schools. But we have had 30 to 40% of children in schools over the last few months as key workers and others. So and the numbers haven't been too bad. So, and schools have put so much in place, and they will have the new testing regime when they come back. So they will have the twice weekly tests for teachers and for secondary school children. So all of these things combined, we hope will keep rates as low as possible, but we do expect a bit of an increase.
Thank you.
Thanks. I hope that answers your question, Simon. We've got a question from Joe, which is around whether the numbers of older people not having COVID in the last 4 weeks and whether that's anything to do with vaccinations.
Really hope so. As we said, it takes a while, doesn't it? Because they've only had 1 dose, and it does take about 3 weeks to start to work properly. So, and it's never 100%. But we're really hoping, and every little signal of, you know, a few fewer outbreaks in care homes or fewer admissions to hospitals in older age group, which does seem to be happening. That's giving us a bit of comfort that it's starting to have an impact, but it's still quite early to say, yes, that's a really big trend. but should be doing.
Right.
The final question we've got for now is from Julie. Do we know why, oh no, another one come in. Do we know why our rates aren't falling as quickly as our neighbours?
We don't, it's a really hard one, that. We do have, Torbay is a small area, and what our intelligence lead always says is we suffer from the volatility of small numbers, because, you know, if you've got relatively small numbers, they will zigzag around a bit. If you've got a mass, you get a clearer trend. And so at some points we've been the lowest, far lower than Devon, Plymouth and Cornwall, and currently we're a bit higher than them. So we're not seeing it as something too concerning, but we obviously watch it day by day and really do, you know, we analyse every case that we get notified of, where they work, what kinds of jobs they have, which geography they're in, if there's any themes and trends coming out. Our current themes seem to be quite a few people who've had symptoms that weren't traditionally COVID symptoms, like they've started with a sore throat, headache and a cold, and then it's turned into COVID, and they've been working while having the sore throat, cold and headache. And it's, although you don't get a test unless you've got a you know, a cough or a fever or a change of taste or smell, it's really worth staying at home if you've got other symptoms you're not sure about and seeing what develops. So there's quite a few of those at the moment, and a lot of our spread just looks to be socially across extended families, or you know, working age people who are going out to work, and we haven't got one particular thing that's we can attribute it to.
I think Ed's got his hand up as well. Edward, sorry.
Ed's absolutely fine. Yeah.
Sorry.
I noticed on the graphs there that although the over 60s rates were falling and the under 60s appear to be climbing there, alongside the information that we've got that during the vaccination programs with other diseases, that new variants do tend to come out at the point where where vaccinations are being rolled out. Is that an indication that you know, that other variants are inevitable, but is that something that maybe as a result of other variants spreading, or in the unvaccinated portion of the community, in the way that the under 60s rates just seem to be going straight back up as the vaccinations are being done in the over 60s?
I think there are two things in there, aren't there? There's the Southeast variant, that's now the most predominant one, does spread quicker than the previous, you know, variant that we started with in April. So it does seem to spread quicker. That's not only Torbay, so everyone's got that problem. And as you say, the population who spread most are the population who haven't yet been vaccinated. We vaccinated first the population who are vulnerable but don't spread a lot. We are now moving down into the population who get out and about more and spread more. So we haven't got the benefit of that yet. We haven't stopped the spreading yet. So I think you're right that a bit of it spreads more quickly, and yes, you've not been vaccinated yet.
Okay.
Yeah. Is that all right, Ed?
Yeah, I think it makes sense. It makes sense.
Yeah.
And we're saying that the kids are going back into school as well, and that's something that's been quite of a concern within the community. My wife runs youth groups as well, and you know, we seem to be sort of, you know, doing more of that, you know, community stuff at the same time as doing a vaccination rollout. You know, and lots of people are asking a lot of questions about that. About us doing that.
That's useful to hear. Thank you. I think the messages for children are not going to change. You know, I think the kind of you know, washing your hands, staying 2 meters apart, those things are not going to change. Even if, you know, we have like huge coverage for most of the population for the vaccination, that message is still there. So just assure your wife and the networks that those behaviours and supporting children to uphold as many of those behaviours as possible is going to remain really important for a while.
Yeah.
And we feel reassured that in this lockdown and in the lockdown in the autumn, when people weren't at work but children were at school, quite a proportion of children were at school, their age groups rates remained low. So it does suggest that our schools are not spreading so much, which is a really, really positive.
Yeah.
Brilliant. Excellent. Thank you. It's a good message.
Thanks. Feel free to spread that one around, please, Ed. That would be really handy for us. Any more questions?
There are some more questions in the chat. So we've got one from Tori, which is wondering about whether there'll be any testing within primary schools in the near future, given that there's potential that the new variant spreads quicker among children.
Can we hold that one, because we're about to talk about testing in the community, if that's all right? Is that okay, Julia? Because I think you're going to cover that in a minute, aren't you?
Well, I'm not talking about schools, so I could answer that if you want.
Please do then. Yes, sorry.
No current plans that we know of. Things do change day by day, hour by hour. Currently, as you say, the plan is to test secondary children, not primary. Secondary school children so far in the pandemic have spread more than primary school children have. So the evidence is the nearer they get to adults, the more spready they've been. So the older ones have been more of a risk. And also the practicing they've been doing suggests that for younger children, the testing process is just that much more hard and less accurate, and the benefits you get are not suggesting that it's so successful. So they test their teachers, but they're not currently planning to test their children. So at the moment, no plans to, but they have been a lower risk.
Excellent. Right. Thank you very much.
There's one final question on vaccinations. I'll feed it in, but we can always come back to it at the end if you rather, Sarah. So just a question about the vaccination rollout and which age groups have been done, and whether there is a timeline to vaccinate lower age groups within Torbay.
Okay. I think all I would suggest about that is I'm not entirely sure what the exact answer to that is, but I'm not sure that we can give it to you either. I would just suggest that Devon is really on track for hitting all the milestones around vaccinations, and we're following the guidance that everyone else is in the country, and we're not behind. In fact, we're possibly ahead. I can't tell you exactly what dates that will be, though. It's a bit of a moving target, all this. We've got to get everybody in the right order at the right time. I'm sorry to not give you a really definite answer and say, oh, it's all going to happen on the 1st of April.
We could try and get a latest position update from the CCG for the next, to either put in the bulletin or follow on with, couldn't we?
Yeah, Simon, I sent the latest update that we had from the CCG was all included in the bulletin that was sent out last week. So if you haven't received that, I'm happy to drop you a copy of that with the latest figures that we had with regards to older age groups and where we were up to with vaccination. So I can forward that on to you so you've got that information.
Okay, brilliant. I'm going to move us on. There's another opportunity for questions at the end, but please feel free to keep adding them to the chat. We love your questions. But we're going to move on and talk about, well, what are we going to talk about? I think we're going to talk about community testing now.
We are.
Over to Julia and Alan.
Do you move it on for me, or do I?
Go on, you be Chris Whitty, and I'll push the button.
Next slide, please.
Yeah, I've always wanted to do that.
I wanted to do that. Next slide, please, Sarah.
Yeah, I didn't say I was any good at it.
How many times does Chris Whitty have to say? Oh, right, okay. So just a little recap. I know you talked about testing a bit at the last one, and so this is just I'm thinking of it two ways. I'm thinking of symptomatic testing on the one hand and asymptomatic testing for people with no symptoms on the other. So the symptomatic testing is the same, and that's you go for your PCR test, which is the normal route of calling 119 or booking online and going to Livington Road or Paignton Clement Valley Centre. You get your nasal throat swab, it goes off to a laboratory, they analyse it, it picks out bits of DNA of the virus, so it identifies if it's there, and then you get your result back and you isolate. PCR tests are highly accurate, and they also detect virus for quite a long time. So if you can detect it for up to 90 days after your symptoms started. So it doesn't mean you've got new infection. It doesn't mean you are infectious to others. It can just still pick up the viral DNA. And as I said, high accuracy. It's in the high 90% for a PCR test. Next slide, please, Sarah.
Jumped ahead, sorry.
So asymptomatic testing, which is when you don't have symptoms, and this is done systematically in different, for workforces normally, like in the NHS and social care. This some of it in the NHS they've done using PCR tests, but increasingly now and more widespread now, we're using lateral flow device tests. So everyone's calling them LFD tests. You keep wanting to say LFT, but they're commonly called LFD for device. And these ones are ones you can do quickly on site or at home. And you do your same swab, and then you can analyse it using a few chemicals in a test tube, and you get a result in 30 minutes, and you get a line in there, which is why they say it's like a pregnancy test. You get a line saying it's negative or it's positive or it's indeterminate, and you have to do another one. And this one detects different things. It doesn't find the DNA in the virus, it finds little surface proteins in the virus. So it's got a different chemical or analytical process. And this one, it tells you if you PCR test. So no test is 100% accurate. You can always get a false positive or false negative. You are 60% probably you haven't got the virus now. So it doesn't mean 100%. So careful and not stop doing all the precautions. But this one, because it's quick and easy to do, and it tests people who otherwise people in the community we wouldn't otherwise know who have COVID. And as I said, no test 100% accurate. We measure tests, sensitivity and specificity, and this is a rather lovely thing. So sensitivity is how well it is. And so if you've got a 90% sensitivity, 9 out of specificity is how good it says you haven't negatives. And again, 90% means 1 in 10 will be, there's always going to be the odd one. You'd never get 100%. And these vary. This is really interesting because it varies also on who does the test and how well they do it, obviously, affects how accurate your tests are as well. So a lot of cases in the population, but there's very few, will affect the accuracy of your test and where you are in your infection, because you are more infectious at different times. And the lateral flow test is much better at picking up a test when you're quite infectious and full of infection at that point. It is not so good at picking it up early on or later on. So it's quite a good one for saying, I am infectious now and I've got a high load of virus in my system. Next slide, please, Sarah. Moving on to the community testing programme and how we're going to roll that out. So I was going to hand over to Alan at this point.
Yeah, sure. Thanks, Julia. Hi, everybody. Thanks for your time. Yeah, so with that, the things that Julia mentioned in mind, what we're doing as a council and our response to that is, and you'll see a theme kind of running through this around protect, find and enable. So we're looking at groups that within our community, and we need to provide regular weekly testing to those groups. So that could be people who are working in care homes, could be people in factories, and enabling things that you would expect that would continue, for example, the election. So we're doing some work around electoral staff and protecting them and helping to find cases when people are asymptomatic. So if you could go to the next slide, please, Sarah. Yeah, so as it's mentioned, it's a lateral flow device is a test to find approach for people with no symptoms, focusing initially on for people who have to go to work but work in environments that cannot really very well adhere to social distancing regulations, and they cannot work at home. So these people are, probably at a higher risk of catching the infection during that time. And this is what we're trying to do to help eke those cases out. And as it mentioned, around 1 in 3 people have COVID with no symptoms. So next slide, please, Sarah. So again, so what we're doing in our response to this, we have a 3 kind of pronged delivery approach. We have a delivery approach in the workplace. So for example, an organisation will sign up, we will provide all the kits and equipment and everything they need and standard operating procedures, risk assessments, all the clinical governance to enable businesses to provide testing to their staff at their work location. We've got a couple of pilot schemes running and we're going through that process at the moment this week, and obviously we'll learn a lot from that. We from central government, Department of Health and Social Care, is sharing a lot of training materials, so there's consistency across the region and across the country around how we train our testers to perform that, and some training has taken place with the businesses we're piloting. We've been doing a lot of work and we're about to see some fruition of that work at a semi-permanent site at Key West car park in Clyde Valley, with a semi-permanent site providing access to testing for the community in the wider sense. We are due to start service on Monday the 1st of March, and we will be able to accept bookings via online, and we are looking at people who might not use online methods be able to book and walk up to the booth, predominantly drive through, and the test is conducted for us. But yeah, we're looking to put that in place. There is a booking site that will go live in conjunction with this, and time slots will be available for people to book. They'll get a confirmation email and some information in there. So that's due to start on Monday, which is very exciting stuff going in at the moment. And then we are looking at a more mobile kind of events style vehicle, where we can target our approach slightly in a more targeted fashion in case we get areas of concern, etc. And obviously with the bay not being geographically massive, we can move around and have a little bit more flexibility. Next slide, please, Sarah. Yes, so when we talk about the testing to find at the semi-permanent site, prior to staff where they cannot socially distance, so we've got a set of groups that when you do your bookings, it will ask you what group you're in and what risk you know, whether it's a high risk group or high risk setting, and that will open up some more booking sites. There will of course be sites for people who just want to, you know, ensure that they're getting tests. It will be for people who fall outside of that. And as I mentioned, it's going in at the community testing site at Key West Car Park in Paynton. Next slide, please. A little bit about the technology that Julia touched on and the differences between a PCR and a lateral flow device. Basically, all the kit is provided for us. We've taken delivery of that, and we will distribute that to the local testing site and to businesses who've signed up to conduct testing on their site. So it gives you a little bit of an overview of what comes in the kit and basically how we process the results, etc. Next slide, please. And basically, this just tries to articulate we've got a wealth of resources from Department of Health and Social Care, that we're making sure we're consistent across the peninsula with our groups. We attend regular meetings with them around how they're doing and what processes they're using, and sharing a lot of information. Next slide, please. Yeah, so we are putting some more information on our website. We updated it this week, and there'll be a booking link going on there as soon as possible. I think I saw a question in the chat around when does it go live. It will probably go live on Monday morning, and people will be able to book slots from there. The workplaces with over 50 employees can apply through the government website for industrialised testing, and then the workplaces with fewer than 50 employees who fall into the range of what we're looking to do with our business settings. There's an email address there, and it will be on the website as well, so we can apply. They can apply for on-site testing. We can assess them and help them complete the necessary paperwork they need to fulfil. Yeah, and they can go down that route. Next slide, please. Yeah, just a couple of things that we'll probably see around the bay a little bit more. Some information, you know, and from a communications perspective, to make sure that we're reaffirming the message. Pretty clear. Last thing I want to be is one who spreads stuff at work. So yeah, I think there's another slide as well, Sarah, is another similar thing. Yeah, as it mentions, you know, it's pretty self-explanatory. Yeah, so Sarah, if you could, yep. Any questions? Thank you, Sarah.
No, thank you. So what's in the chat room then?
We have lots of questions. So I'm going to try and just bring these together a little bit. So there's some questions around the process. So when will the booking site go live? How does the business sign up? And if a business has registered at gov.uk for kits and not heard, should they have heard so far? That's the first three, and then come back to me for some more.
Okay, I'm happy. Yeah. So at this stage, we expect the booking site functionality functionality to be live on Monday morning, for people to be able to book slots. Hopefully it'll be earlier, but at the latest it'll be first thing on Monday morning. People or organisations or businesses who fall into the under 50 levels can email the community testing mailbox, the website and on the address there, and we can pick that up. And as for the .gov stuff, if they've registered and haven't heard, I'm not sure actually, but it's an interesting question. We'll need to check on what happens if organisations don't hear back if they've gone through that registration process.
Alan, would you be able to maybe let us know for the future kind of comms, either the bulletin or the forum, and then we can provide an update back to the champions what to do if they've not heard?
And they
No
could,
problem at all, sure.
we're creating a Rob for our back, but they could email our community testing email if there's an issue, and we can follow up.
What's the email for that, Julia, please?
It's on one of the slides. It's communitytesting@torbay.gov.uk.
Yeah.
Thank you.
Okay, I've got some more questions. So one's, how quickly can the kits, I think it's be distributed? And can you enforce testing if they refuse?
So from a distribution perspective, we have an organisation that we're partnered with that will distribute kits to organisations. We have to go through some risk assessment and making sure that the appropriate governance and training is in place. But and I mentioned we're trialling it, that we're piloting it this week, but I would expect a turnaround time to be fairly quick if we've got people who are willing to do the training for the testing. We need to do a little bit of back office stuff to set up site IDs and various things like that. But I would say probably less than a working week, I would suggest, from application to having some kits arrive, as long as we can complete all the relevant documentation.
Good news. Really good news.
Sorry, what was
I
the
don't
other
think you can
question?
enforce it. I mean, signing up is voluntary and doing a test is voluntary. So currently there's no enforcement around it. There's more like promotion and, you know, the message like Alan showed, which is like, how can I protect my family, my workmates, and not be the one in the workplace who isn't, you know, making sure everyone else is safe. There's that sort of peer pressure, but there isn't an enforcement to take a test. And the thing to emphasize all the time is, do not use these tests if you have symptoms. If you have symptoms, stay at home and take a PCR test. Well, go out and get your test and then stay at home. It's not for people with symptoms. It's only for people who have no symptoms at all that we use this one.
There are a few more questions, but there's also a hand up, I think, from Edward.
Edward, yeah.
That's our Ed. It's all right. We know each other now. All right, Ed. What's your question, Ed?
He's
You're on
taking it
mute,
down
Ed.
again. I don't know if he's.
Oh,
He's on mute.
maybe we've answered it.
I'm muted. I was seeing if you could read my mind.
Not yet. We're working on it though. Thanks.
Yeah.
Epic fail.
Okay. Yeah. I was leaving it on the astral plane, seeing if you could read it out to everybody, but useless. I'll put in a complaint
Good work,
later.
mate.
Right. So I'm just thinking. I'll try and cover two areas of this. So in the organisations that you're supporting, one of the questions that I've got is about whether this covers the third sector for people that are supporting people in the community. And in addition to that, I'm just thinking of the homeless community. And in addition to that, some of our providers that are also opening hospitality during the lockdown in supporting some of the homeless community is is the support, are they going to need to approach you for their for this testing support, or is that something that they're going to do through us, or are we going to do that through you?
We've already got testing for some testing going on in the hostel and some homeless sites. I think we haven't yet got them in the temporary accommodation sites.
That's the ones I'm thinking of, because they're like individual businesses that are running.
Yeah, they can do that through us. We could do that through the model of agreeing with us that they are happy to run it on site, as long as there is someone who can manage it on site. The other option would be they could sign up and get a slot. If they can travel, they can sign up and get a slot and come to the semi-permanent site. There's a question there saying, what does semi-permanent mean? Basically, it means that it's permanent at the moment, but we hope that we won't need it forever because we're just responding to the pandemic. But it's not a mobile. Mobile ones move about and you can take them to different areas, but a semi-permanent one means we've set it up in a static format for as long as we need it.
Okay, so as far as rolling out that information is concerned, right, shall I take that to accommodation and just inform all of the, if I inform all of the providers that are available to us in a group, you know, thingies, and then say this is available to you if you want it, and then they take that forward.
And they could email our email number thing, and we can help them work out which is the best route for them, whether it's better for them to do it in their building or to come onto site and take it there.
Okay, that would be fantastic. In the third sector,
we're actually talking to the Torbay Voluntary Forum this afternoon about it. Yes, definitely available to third sector, because a lot of people in community roles are going out and mixing as part of the support and work they're doing, so definitely available to them. And then again, it's a case of, do they congregate in a site, in which case they might want to do it on site, or if they're more mobile, then they probably
I think often they don't feel like they're working in the role, do they? If they're volunteering, it's like, well, actually you're valued as very, you know, you are doing, you are working,
definitely.
you are going to work, you're not, you're not paid. It's nothing to do with it.
Real target audience. I mean, in that way, getting tested is keeping the other people safe more than keeping you safe, but it's definitely a good idea, especially because they're working with the vulnerable and they're going out and about.
Excellent, thank you.
Brilliant, good questions and lovely presentation as well. Thank you, Alan. Thank you, Julia. Anya, are there any more questions in the chat that we can address right now about testing or other things? Go on, go for it. What have we got?
So we've got a question. Hang on, sorry, I'm trying to keep them similar ones together, but also cover everything. So we talked about enforcement, but there's one here about whether there's a chance that businesses might not pass the tests on to staff if they didn't want their staff to be off work. So that's one question. What would be done about that if that were to happen? There's another one which is just, could you confirm whether this information will be put on the Torbay website? And then there's one about vaccinations, so we can come back to that after those two, if that's right.
That's really interesting, that enforcement thing. I was just looking at it, at the link. I think you can definitely, there's certain rules around if someone has symptoms. So if someone has symptoms or has tested positive, there's legislation to support people following the rules and isolating and not coming to work and all that kind of thing. I don't think we have any enforcement powers to make people do asymptomatic testing. I mean, even, you know, teachers in schools can refuse if they want to, but it's the pressure. It says in your link, doesn't it, that it's the case of the employer saying we want to keep people safe. Can you please participate, everybody, to help keep people safe? The other thing you've raised, which is really important, or is in your link, which is really important, which is we don't want employers to think, oh no, I'm going to find a whole lot of people with COVID and I won't have a workforce. The percentage of people we're finding on lateral flow testing is really small. So it's really good to stop you getting an outbreak. You'll identify someone you wouldn't have known about and you'll stop them spreading it, but we're not picking up high numbers. So it's very unlikely that you would introduce this testing and suddenly everyone was off. So that's something we want to dispel. It will help you prevent an outbreak in your setting. It's a real message. Yeah, agree.
Right.
And there's one final one about vaccinations. So just before I ask the vaccination question, I just want to flag that Amber and I have put a few links into the chat and also the email address that Julia mentioned, which is the community testing email. So if anybody does have any questions that we've not managed to cover today or that occur to you later, or you don't feel have been answered, then please do get in touch. The final question's about vaccinations, which just says, will the Riviera continue to be a vaccination centre throughout the rollout over the summer, or by then will vaccination be at local doctors? And then moving forwards, if we're needing boosters, would we still require large vaccination centres?
Great question.
Can't look into the future. I don't anticipate the mass centres stopping until we've got everyone vaccinated this time round. And there's quite a preference for having your second jab where you had your first jab, because it's much easier to manage the process. You get the same you know, you get the same vaccine and the organisation is much easier. So they tend to like you coming back to where you had your first jab, and it's much easier to manage. And the Pfizer vaccine is much easier to manage in large amounts in large sites because of its storage problems, because it has to be stored so cold. I know a lot of practices are now able to deliver vaccines, so we've got quite different models going on. Some pharmacies are now able to deliver vaccines, so we probably will get more and more of that as we go on, but I can't see the sites disappearing for quite some months. No idea what will happen if it becomes a regular thing like flu. I don't know what would happen then and how that would work.
Okay, brilliant.
Great.
Thank
So
you
I
very
think
much.
to stay tuned on future vaccination plans, it's not yet decided. That's all. I think I've gathered everything from the chat. If you think your question hasn't been answered, please do speak now.
I think, oh, David's got his hand up. Hey, David, what would you like to ask us?
Yeah, so just to provide a bit of feedback, if it's correct on booking vaccinations. I received a letter on the 9th of February indicating I was now in the target group. Having spoken to the booking line for the NHS, I was advised just to keep repeatedly going through the booking website to book at the Riviera Centre. What I established today from the Clinical Care Commissioning Group is that the Riviera Centre is not part of the national booking system. Okay, so I think that needs to be raised or publicised more widely, and maybe the call handlers on the national system need to be advised of that. And also, having tried to book online today, made in total 6 attempts, the system tells you one of your options is not available, please rebook. But it doesn't tell you which of the pair, first or second vaccine, is unavailable. It takes you back to the very beginning, which involves entering all your data again. So there's some defects in the system. I don't know how to feed that back other than through this forum.
We have a query line with the CCG vaccine delivery service for Devon. So if we can forward your query to that or link you up to that query line, we can try and get an answer for you there.
Yeah, okay.
Have we got a record of you?
Would you be, David, would you be able to email that to the Champions inbox and then we can forward it on appropriately?
Yes, we'll do. So,
great, thank you.
There's a helpful comment here from Eileen, however, who says Riviera is doctor referred, I think. I don't know if that helps. I don't know if it is, I'll be honest, I don't know either, but thanks for your comment, Eileen, that's really helpful.
It's Nigel. It's probably true, and the reason I say that the central, I assume they class them as central government NHS letters that are following, telling people they aren't sending them to the hospital or the Riviera. It's usually Exeter or further afield.
Okay. That's great. I wonder if we can pick up vaccinations for a future forum. I sense that there's going to be more questions coming, and it might be useful for us to go back to doing vaccines. Would that be helpful for all of you? I hope so. Yeah. Now listen, we're down to 10 minutes, so I'm going to move us along if I may, unless there's an absolute burning, if we don't answer this, everything's going to explode question. Great, I'm going to move on. I think it's time we ask
Hazel, sorry, Sarah.
Sorry, Hazel, sorry.
Hello, I've just put it in the chat. What's happening, if you go online, you can get the Exeter site, but if you phone up on the phone number, it tells you the nearest site as the crow flies, which is Exmouth. Well, as we know, that's almost twice as far as Exeter. So if you do your booking on the phone, ask for Exeter, not the Exmouth one. But yes, it's the doctor's appointments that are referring you local to the Riviera Centre. So what I believe what they're saying is, if you have got transport, please go to the Exeter site, because then it frees up the Riviera Centre for people who live in Torbay who haven't got transport. That's all. Thank you.
That's fabulously helpful. Thank you, Hazel. Thank you very much indeed. See, champs helping champs. This is what it's all about. That's brilliant. Right, are you ready for us to ask you a question? We love that you ask us so many questions, but you know, you're the champs, you're the ones spreading the good news. So we thought we'd ask you a couple of quick ones. Public health team, I'm going to do the first three and see how we're doing for time. If we can do the last two, then we will. So you've got a polling, you've got a vote button, and I'm going to ask you a couple of true or false questions. So the first one, hopefully a bit of an easier one. Anya, can you launch the poll, please? Oh, look, there we go.
I've launched the poll. You should all be able to see these questions.
So let's see what you've got. So question one is, you can have COVID-19 and pass it on to others without ever knowing you have the virus. Is this true or is this false? Question two is, if you've got COVID-19 symptoms, you must self-isolate, but anyone you live with can still go out. Question three is, if you have COVID-19 symptoms, you should get a COVID test and isolate for 10 days, whatever the result. Question four, bit of a curveball with this one, to be fair. But the question is, most local and national COVID transmission happens in shops and businesses. Is that true or is that false? And the last question, let's see if you were listening to Julia and Alan. I've had a negative lateral flow test, so I'm definitely not infectious. Is that true or is it false? So we've got, most people have just about voted now. I feel like, what is it? What's his name? Chris Tarrant. Da, da, da. It's like a game show, isn't it? We're going to do some hosting. The questions, we're going to close the poll. Get your last answers in now.
Can we phone a friend? I think Eileen said.
That's what it is. Do you want to write? Yeah, quickly text a friend, phone a friend, check the website.
You've already asked the audience.
You are the audience. That's the one. Thanks, Ed. Thanks, Amber. You know what I was alluding to. Okay, let's do the scores on the doors then.
All right, you ready?
Yeah.
So here you go. Can you all see the results?
Yeah, I think to be I've just noticed something that I didn't notice before. I think we've misled people on one of them.
Oh, no.
I know, which is number 3.
Yeah, a bit of a trick question, isn't it?
Yeah, I think we've missed it because if you don't get
Okay.
a test, you would isolate for 10 days. Yeah, if you do get a test and it's negative, you just isolate until you are well.
So let's start with question 1. Oh, look at this. 100% of people said to the question, you can have a COVID-19 test and pass it on to others without ever knowing that you have the virus. True. Fantastic. Yeah, you're absolutely right. Anya, can you do question 2 for us, please?
Is it not still there? Can you not see question 2?
Yeah.
Yeah, okay, sorry.
So if you've got COVID-19 symptoms, you must self-isolate, but anyone you live with can still go out. We had 36% of you say this was true and 64% of you say this was false. Ooh, bit of a split decision there. Julia, can you give us the answer, please?
They can't go out. You should go and get a test though. And then if the test is positive, everyone stays in for the 10 days. If the test is negative, then you wait till you are well and they don't have to stay in with you. So at that point, you should stay in.
All right, great. Now, sorry about this. Question 3, I might have done a bit of a curveball with this one. So the question 3 is, if you have COVID-19 symptoms, you should get a COVID test and isolate for 10 days, whatever the result. 64% said this was true, 36% said this was false.
I think we've led them up the path by making everyone think that we should isolate, which you always should. But yeah, if the result is negative, and then you just isolate until you're well. But the only instance where that wouldn't happen is if, for example, there's a family of you, 3 of or 4 of you in your family have got COVID symptoms, 3 of you have tested positive, 1 has tested negative, we or Public Health England might in that case say to you, we think that's a false negative, and we might ask you to isolate, just because 1 in every so many results might be a false negative. But that is introducing a complication into it.
We'll do better questions next time. Question 4, most local and national COVID transmission happens in shops and businesses, true or false? Again, it's a bit of a funny question. Most transmission happens in social groups, social networks. And what we're seeing here in Torbay is it's sort of happening through things like extended families and larger bubbles and groups within groups. So it's not true that most COVID transmission happens in supermarkets, for example. That's not really true. It doesn't mean it can't happen in supermarkets, but you're more likely to get it by the 6 people that you saw this week. So the message that we want you to give out is most COVID transmission happens in personal groups and networks, not necessarily in shops and businesses. Oh, Julia, you'll be pleased with this. Look at that question number 5.
I know, it's lovely.
10%.
Beautiful. It's admirable. Yeah. It gives you, it helps to find people, but any negative test, well, everyone now should always act as if, just in case, as if they're positive. And it's what we're all doing until sufficient numbers of the population have been vaccinated. So always be cautious and always worry that even if you've tested negative, you should still be really careful.
Okay, great. I'm going to quickly, if I may, we're coming quickly to the end, but we have something that we would like to ask you, please. We need your help. Your mission is, we need your help with 3 things, please. We really would like you to share a fact with a friend. The point of Champs is that you are spreading right information and good information. And actually, there's a little bit of an ask on us to say, well, what's Champs doing? Is it working? And we need you. We need you to share a post with your people if you're on social media, whatever that media is. And we've put a few links to some things that you can share. The Torbay Council website's got lots of things you can share. The NHS website's got lots of things you can share. But we would love to see you sharing a post with your people, whoever they might be. And the third one is, can you help us recruit a champ? A few people that we're not seeing so much of. So we're quite interested in hearing from some of our younger community in Torbay, particularly, as you know, that 20 to 60-year-old age group, you know, working populations. But help us to recruit a champ, chat them up about it. We'd love you to use these hashtags. For those of you familiar with the world of hashtags, helps us see what you guys are doing. If it's not your thing, don't worry about it. We won't cry, but it would be lovely if you could use it. Anya is going to talk to you about what to do if you're feeling brave as well.
So our final ask of you today is, if you're feeling up to it, we would be interested to hear how your experience of being a champion has been and how we can make it better for you and your community and make sure that it's useful. And then our final ask, if you would be up for it, we would like you to take a photo of yourself with a piece of paper or a card that says, I am a COVID champion. If you look at Amber, she's demonstrating this. I can't see if Sarah, I can't see everyone's slides at the same time. Sarah's also got one. If you could do that and email it to champions@torbay.gov.uk, we would be very grateful. Or you can make a little video and just say what it is that you like about being a champion, what you've done with the Champions programme, how you use the knowledge that we give you, or similar. So we would be absolutely over the moon to receive some things, photos, videos from you, and please send them in and we will be eternally grateful. And I think, is that the last slide, Sarah?
That is the last slide, mate. Yeah.
That's the last slide. So I just wanted to say, I'm not going to be doing Champions now moving forwards. I wanted to say thank you very much to all of you for being amazing champions and for making this programme the success that it has been and hopefully will continue to be. And I know that Sarah, Amber, Julia and the team moving forwards will be doing a wonderful job. So I just wanted to say thank you very much for your time, dedication and hard work on this topic.
Thanks, Anya.
We thank you, Anya. Yeah, it's for all you've done as well. It's been brilliant.
Yeah, nice one.
Thank you so much.
Thank you.
So as usual, copies of this will be up on the website soon. The bulletin will come out to you all next week and we'll respond to more of your questions. Sign up is on the website, so encourage people to sign up there. And if there's anything you need or want in the interim, including knowing what other tricks Julia's cat can do, please just drop us a line. All right, this is what we're here for. I know some of you have got to go. We'll try and run through any other questions for those of you. Oh, there's a question. Julia, what's your cat's name?
He's called Blackie. He's old now. He was a stray, but he has no manners and he's hungry and he eats me. I'm so sorry. But he's lovely, really.
Oh,
and he's my lockdown champion.
Yeah, man, I wish we could have a pet session. That would be nice, wouldn't it? Pet champs. That would be a great photo. Take a picture of your pet champ.
Yay.
Okay. Well, look, we'll leave it there. Thank you very, very much, everybody. It's been a fantastic session. We hope you've learned something and enjoyed stuff. Any feedback is really, really welcome. We'll let you all go.
Thank you all very much. It's great to see you.
Thank you, champs. Keep doing great work.
Thanks, everybody.
Thanks, bye.